the National Neonatology Forum, it is a privilege and a pleasure to interview a doyen in the field of neonatology, a lady who's always been ahead of her times, be it starting the first human milk bank in Asia, advocating family-centered care, almost 3 decades before it became a norm in our country. And of course, one of the past presidents of the National Neonatology Forum. Welcome, Dr. Armida Fernandez.
Thank you.
So, Madam, myself, Dr. Jayashree Monkar, and my colleague, Dr. Ruchi Nanavati, both of us Professor Emeritus in hospitals, municipal hospitals in Mumbai, would like to take you through your whole journey, showcasing all that you have done for saving newborns. So let's start with, when did you become a member of the National Neonatology Forum?
So I became a member of National Neonatal Forum practically the year it started, 1980, 1981. And almost 20 years later, that is in 2003, I became the president of National Neonatal Forum. So 2000 and 2003 and 2004 were the 2 years I was the president.
You were the president. So you actually became the president almost around the time that you retired, right? So I'd like to showcase, what you did even before you became the president, because your journey in the neonatal field has been wonderful and, so bright. So can you tell us in brief a little bit of what you've done when you were the professor of neonatology and the dean of Sion Hospital?
So I think one of the reasons I got into neonatology itself was, Sion Hospital, it's a Lokmanya Tilak Municipal Medical College and Hospital, is next to Asia's largest slum, that is Dharavi, that everybody has heard of. And most of our patients came from the slums. I always said the dying, the dead, and the desperate and the poorest came to our hospital. And at that time, newborn babies were looked after, actually normal newborns by obstetricians, and the sick one by the pediatricians, all the pediatricians. And when we analyzed the mortality rates, we found astonished, embarrassingly high mortality rates in the neonates. And that's the time I decided I must try and do something to decrease newborn mortality in the hospital. And that's, I think, that time I just turned from a pediatrician into a neonatologist with only one thought in mind: how do I bring down neonatal mortality rates? And remember, we were in a municipal hospital. So municipal hospital at that time was known that they have no staff, they have no money to buy equipment, and therefore it was not easy to bring about major changes. And so I thought that we have to bring down the mortality within the circumstances that were available in Sion Hospital. And therefore I had to use the low cost measures because equipment and staff was not available. So what are the measures? I found the cause of infection were incubators, and we couldn't buy new ones. The Klebsiella, Pseudomonas in it, so we really got rid of the incubators. And I used techniques, low-cost techniques like a heater in the room, lamps over the baby's different wattages to keep the baby warm. We realized another cause of infection really was, they fed top milk, formula milk bottles, and many of them got diarrhea, they got sepsis, and they died. And therefore had to take that decision that we have to stop bottles, stop formula and animal milk, and use only exclusive breast milk for our babies. So we struggled for some time with getting milk expressed and then saved and then given to the baby. But finally, to ensure a continuous supply of safe human milk, way back in 1989, I started the Human Milk Bank. I think other things that I tried which made a difference to the baby, we had only one nurse. And where do you get nurses? There was no way we could get more nurses. So I changed the rules of the premature unit where they said no entrance for mothers, and I made every mother come into the unit. And therefore, every baby had a nurse. She looked after the baby, she changed the baby, and she fed the baby. She held the baby to the breast. And I think not only because there was this human milk, the touch, but the vibes that went from the mother to the baby, I love you, you need to live. I think even that helped save our newborn babies. And let me tell you, simple measures, of course, then we went to NICUs, brought down the neonatal mortality rate tremendously. So this was my journey in bringing newborn mortality rates down in the hospital. I think the second thing that we did was, PGI Chandigarh had the DM neonatology program established. No other medical college had it, and we instituted, I think we were the second hospital together with the KEM that started the DM neonatology course. So we were the second institute that had it. We had students, and I think it made all the difference both to the unit and to the babies when we started our course of DM in the institution.
And that was really inspiring work.
Yeah, madam, tell us what are the major initiatives that NNF undertook during your presidency when you started in the year 2003?
I must say, one person takes the credit what a team of people do in the institution. And I must say, I'm very fortunate to be interviewed by Dr. Jayashree Monkar and Dr. Ruchi Nanavati. Both of them worked with me. So when I said brought down neonatal mortality rates, I started the milk bank, I did it. It's not me. We did it as a team. And the same holds true for NNF. You can't do anything alone, and I had so many people to help me. I was fortunate to have Dadish as the secretary, and we had Saluja as the treasurer. I remember Jayashree was one of the executive board members, and Pejawar, and so many. So whatever was done was not done single-handedly, but as a team. So one of the things that I remember that we did was we realized that there were no standardized protocols for dealing with newborns in an NICU. And although neonatology was being practiced by many institutions across the country, so we brought out the first protocol book for standardized protocol for neonatal care, done by the editors were Dr. Jayashree and Pejawar, and they of course invited a lot of people to be collaborators for that. The second thing that we did was that there were the NNF didn't have an office. They were 24 years down the line, and there was no NNF office. And during our tenure, the office for NNF was secured in Delhi, and that I think the office still continues. The third thing is, although the Journal of Neonatology was in existence, it was not yet indexed. So we made sure that this journal was indexed. And two things that I remember the 2003 conference, 2004 conference. The 2003 conference is when we got the first day cover, so that the country knew that there was something like neonates and neonatology and National Neonatal Forum. So this cover was introduced in 2003. And finally, on the last year of my presidentship, we had the SOIN report, the State of India's Newborns. And this was the first time such a book was released. And it was, all the details of neonates in the country. And this was thanks to Dr. Vinod Paul, who made sure that this journal got all the necessary people to write and fund the SOIN report. This is one person I always admire because he never became the president. But what he's done for neonatology in the country in the background, working with the government, with international agencies, not only did but continues to do, is to be admired.
Thank you, madam. That's really amazing to see how much work is done during your tenureship. It is inspiring not only for us but also for the future generations of neonatologists in the country, related to Journal of Neonatology, SOIN report, and so many things which you have just described. So I'm sure this must be very challenging. Can you tell us what are the challenges and hurdles did you face during this your tenure?
I don't know whether I'll call it hurdles, but yes, there were challenges and probably challenges for NNF across the years. The point is that there were very few institutions that had DM neonatology course. There were so many hospitals, but there were no recognized neonatologists because it was very difficult to get a college recognized for DM neonatology. Actually, when I was the president, we went and met with the Indian Medical Council trying to ensure that we would get the more and more DM courses. So a big challenge was lack of doctors trained in neonatology. That was a huge challenge. The second challenge was forget about doctors. We didn't have enough nurses trained in neonatology, and the most important aspect in a neonatal unit, you need a doctor trained, right? But you need really good trained nurses. And this was a huge gap that needs to be addressed. And we had also just started working on it, but it took time. We could never complete that neonatal nurse, start the training courses for neonatal nursing. The third thing that was lacking was we were working in neonatology for a long time, but our country lacked good research happening, on a big scale in neonatology in the country. Uh, Maybe because we, at that point of time, research was not a priority in our country. We were not trained in research in undergraduate, to some extent in postgraduate, but not good quality research. And we had started, I remember, a research committee, but we couldn't take it ahead at all. But this was a huge challenge. I thought this is something that needs to be done. And finally, because that's where my heart is, uh, how do you reach neonatal care to the areas in our country? What about the rural areas? What about the tribal areas? How do we reach it? And before my time, there are the presidents who had started the district training program for newborns, and it had already been started. But then the training happened, equipment had to be reached, but to ensure that training happens across the country, ensure that the equipment that has been given by UNICEF it works. And despite that, there were huge areas in our country that were not yet reached. Not just the rural areas, but the poor. What happens to the urban areas? What about babies in the slums? So there was a lot of work to be done, and I think these were the challenges that we had at that time and that we wanted to address.
Hats off to you, madam. Your work in the field of neonatology has gone a long way in improving the neonatal care in the country. Thank you so much. So, madam, you really identified the challenges and started working on it. And many of them have actually come into the reality today. The solutions have come to many of the problems, and your contribution over the years has gone a long way in improving the neonatal care in the country. We would also like to know what are the watershed events you faced during your tenure?
So you know what? It's because me. I've never been into neonatal intensive care, the latest in ventilation. What are the new methods? Yes, it forms a very, very important part in saving newborn lives. But where my heart lies is that in a country like ours, my watershed moment would be what are the things that people have done to, at low cost measures, that would save babies across the country, whether they have hospitals or not, or whether they have ventilators or not. And I think one watershed moment I would say that I'm really proud of is when we went and taught people exclusive breastfeeding. During the BFHI movement, we were all part of that movement, and it went across not only urban, rural, all over the country. So that for me is promoting of exclusive breastfeeding was a huge watershed moment. The second is that the starting of the human milk bank. When I started it, of course, people were not willing to accept that there is a need and what is a human milk bank. But today, there are, I think, more than 120 milk banks or more in the country. And more important, people realize the importance of a human milk, not only for normal newborns, but also for the sick neonates and preterm. So much research has come out to show the need for it, and therefore, more and more milk banks are coming up. And I think all those involved in the breastfeeding movement and milk banking, Jayashree and whole team, I think Ruchi Nanavati also started the second human milk bank at KEM Hospital. All that helped in ensuring that breastfeeding, human milk banking, low cost, at least breastfeeding was a low cost measure. The third thing is that I really feel is a watershed moment is a simple technique of kangaroo mother care. All you need to do is put your baby on your chest, skin to skin contact, mother, father, whoever is around, makes so much difference to the baby, doesn't cost anything. And for those who pioneered this, hats of Dr. Shashivani, Dr. Rekha Udani, Dr. Ruchi Nanavati, and many more. I'm just talking about the names that come to my mind. I think they did an immense job of that. So for me, I think these low cost techniques, that are my watershed. And I think the most important watershed moment then, because I had realized even when I had become the president, it is not just working in the hospital in intensive care units, but moving from there into where the communities where the mothers and babies lie. And I think that would be, I think, the most important watershed moment as a president and after.
Madam, your work has really been inspiring, over this, right from your days in neonatology through your presidentship. But very few people actually know that Madam's post-retirement era has been equally or perhaps more scintillating than what the previous one was. And Madam, I remember when you were just about to retire, you started the NGO Sneha. And today Sneha is actually running on autopilot. So can you tell us a little bit about your activities at Sneha?
I think the reason I started Sneha, that's the reason. One of the reasons I started Sneha, the most important reason is I wanted to ensure decrease mortality of newborns and ensure healthy newborns. And I realized, like I said before, that if you had to do that, you can't only work in hospitals, you need to work in the communities, in the homes, in the societies where these mothers come from. So Sneha was started with the idea of looking at that neonate in many forms, and Sneha stands for Society for Nutrition, Education and Health Action for Women and Children. Programs are maternal and newborn health because we wanted to say if the baby has to be healthy, of course the mother has to be healthy, and child health and nutrition. The third is a big program that we had was violence against women, and you'd wonder why, as a neonatologist and looking at health, we talked of violence because we had a 6-week baby that was raped and brought to our hospital who didn't make it. And that time I saw that when I retired, this is something I look at, and it plays a very important role in the health and of that mother and the health and survival of the newborn. Now we realize it. And we also realized, Jayashree, that because when you work and you want a healthy newborn, you can't work only at the mother. So the adolescent girl must be healthy, the child must be healthy. And now we really work on a life cycle approach. I think what is important, and this is whenever we work, we need evidence. And we in Sneha have, over the last 25 years, the 25 years have gone so quickly. All our programs are research based, and we have published a lot of the work that we have done in the slums. And more recently, of course, besides Sneha, something that I started more recently is the Romula Palliative Care Unit. I moved really handed over Sneha, moved into palliative care. I lost my only child, Romula, to cancer, and at that time I realized there was a huge gap in the management of all life-limiting disease, not just cancer, and the way to do it. And most doctors, including me, when I lost my daughter, didn't know about palliative care. And therefore, my mission now is really to ensure that all suffering, that we have to look at all suffering, not only of the patient and caregivers, all life-limiting disease, and see how we can address it to improve the quality of life of those who suffer.
Thank you, madam. Your work, even after retirement, after your presidentship of NNF is over, is really amazing and inspiring to all of us. So, friends, we have given you only a glimpse of the wonderful work done by our beloved madam over the years. Dr. Fernandez, a true pathfinder, is really a teacher, guide, mentor, philosopher to many, many of us across the country, and she has shaped our lives. I remember what Albert Einstein has said, that education is not just learning of facts, but training of minds to think. And this is a gift given by a madam to all the students, to lakhs of students across the country over the years. In the realm of medicine, there are individuals who transcend the boundaries of their field and become icons of knowledge, compassion, and integrity. And Dr. Fernandez is undoubtedly one of them. As we are interviewing her today, I can see it's raining heavily in Mumbai today. And I remember what Dr. Abdul J. Kalam has said, that all birds find shelter during the rain, but eagle avoids the rain by flying above the clouds. The problems are common in life, but your attitude makes a difference. And this is what Dr. Fernandez has taught us over the years. And I'm very thankful to her and grateful to her for all these things. Today, Jayashree and myself are very happy. And in fact, we feel honored to have interviewed her today. And especially, we won't forget this day in our life because it happens on a Guru Purnima day. Thank you, madam. Thank you very much.
Phoenix. Enabling life.